Hello. Today we'll talk about abnormal behavior in a historical context. So what is a psychological disorder? A psychological disorder is a psychological dysfunction. And dysfunction is a breakdown in cognitive, emotional, or behavioral functioning. And when we talk about breakdown, we're talking about a breakdown in cognitive, which means somebody's thinking, emotional, or how they're feeling, or a breakdown in behavioral, what they're experiencing and how they are being in the world around them. It's a personal distress. In somebody who's having a psychological disorder, it's difficult performing appropriate and expected roles. They're having a difficult time in their daily activities of life, in their social, emotional, peer relationships, work relationships, and school relationships. An impairment is set in the context of a person's background. So depending on the person and their experiences, their own impairment is contextual to them and their own experience. What we're looking for in terms of psychological disorder is something that's atypical or not culturally expected in terms of their response and how they're being in the world around them. And what we're looking at is a reaction that is outside of cultural norms, meaning people are behaving, experiencing, and thinking outside of what the cultural norm would be for them in their particular cultural context. So let's look at abnormal behavior defined. What is abnormal behavior? Abnormal behavior is a psychological dysfunction associated with distress or impairment in functioning that is not typical or culturally expected. So we're talking about a dysfunction that is very much outside of the norm of what would be the expected cultural norm for behavior for that individual in their particular context. The Diagnostic Statistics Manual, the DSM-5, which is a very important resource for our course, and then I will also discuss how we access that in a separate video, it contains diagnostic criteria for abnormal behavior. In the field of psychopathology, we are looking at the science of psychological disorders. In Canada, the science of psychopathology is done by mental health professionals, and the PsychDs or the PhDs are the clinical and counseling psychologists that look after a number of clinical aspects of mental health. Other professionals that are involved are MDs, or medical doctors, and medical doctors are psychiatrists. They go to medical school, and then they specialize in psychiatry and become psychiatrists. In Canada, we also have MSWs, or Masters of Social Workers, and they work in psychiatric and non-psychiatric social work settings. We have MNs or MSNs, which are specific psychiatric nurses that specialize in working in psychiatric mental health within the health settings. And then there are many lay, public, and community groups that address mental health issues, such as mental health associations, mental health workers, and mental health supports within the community. In Canada, there are currently approximately 3,600 psychiatrists and about 13,000 psychologists and psychological associates, and 11,000 psychiatric nurses that practice within Canada. When exploring abnormal behavior, we're really looking at professionals as scientists and practitioners. Scientists or practitioners are producers of research, consumers of research. They evaluate their work using empirical methods, and we use an evidence-based practice to determine what interventions work and which ones don't. So let's look at how we clinically describe a condition of mental illness. So first of all of psychology or mental health issues look at a clinical description that begins with a presenting problem. What is happening for that individual? And let's say, for example, for our purposes, the presenting problem is severe and troubling anxiety to the point where an individual is unable to function in their social work and home environment. So what are our aims? Our aims are to distinguish the anxiety, the clinically significant dysfunction, from the common human experience.
When we look at a disorder, or in this case anxiety, we look at and describe the disorder from the perspective of prevalence and incidence of disorders. So prevalence meaning how frequent is the particular clinical circumstance occurring within a given society or in a given culture or within a given population, and or the incidence, how often is it happening, how many times. We describe onsets of disorder. And when we describe onset, which is the beginning or the start or how the presenting problem occurs, we describe it from acute to insidious. Is it sudden? Is it severe? Is it a very profound beginning of anxiety? Or is it insidious? Is it occurring over time and less severe, but as it builds, it becomes challenging and problematic? We describe the course of disorders. So we look at the course from episodic, or a moment in time, time limited. Is it a short period of time, or is it chronic? Is it happening all over and in every part of an individual's life? We also look at prognosis, and we look at prognosis as being good, meaning that we can do work, whether it be through psychopharmacological processes or behavioral processes, that with that work and the understanding of what we know about a disorder, we have a good prognosis versus guarded, which means that it is certainly more complex and more severe and more challenging to treat. So let's look at what etiology is. Etiology is the idea of what contributes to the development of the psychopathology. So for example, when we look at our individual with severe anxiety, how did that anxiety come to be? What happened for that individual from a biological, from a psychological, and from a social emotional perspective that contributed to the development of that anxiety. In terms of treatment development, we also know that we are exploring and looking at how we can alleviate the psychological suffering of an individual, and that is really the goal. So when we look at our anxiety, how can we help an individual who's suffering from severe anxiety alleviate that anxiety, that uncomfortable feeling, so that they can function within the context of their life? And this treatments or these treatment developments include, like I suggested, pharmacological, medication, psychosocial, behavioral treatments, or psychoanalytic treatments, or combined treatments, which is the combination of medication and psychosocial treatments. Research in the areas of developmental or mental illness or cognitive, social, emotional issues are really looking at how do we know that we've helped somebody. So when we have a treatment and we want to research that treatment, we are looking at how we know that that treatment was effective and it helped the group of people that that treatment was applied to.
Major psychological disorders have existed in all cultures and have crossed all time periods. So let's look at some of those cultures and time periods to understand how causes and treatments of abnormal behavior took place. In terms of the human condition, the treatment and causes of abnormal behavior widely vary depending on the time, the culture, and the worldview. There have been three dominant traditions, the first being the supernatural tradition, the second being the biological tradition, and the third being the psychological tradition. The supernatural tradition really looked at deviant behavior as a battle of good versus evil, where the church, the state, where religious fundamental beliefs really explored deviant behavior as caused by demonic possession, witchcraft, or sorcery. In terms of how these traditions treated this kind of deviant behavior. These treatments could include exorcisms, tortures, beatings, and crude surgeries. These traditions looked at the stars and the moon as causes for deviant behavior as well. The biological tradition is really born out of Greece, where Hippocrates really started to explore abnormal behavior as a physical disease. And Hippocrates is a Greek physician in the age of classical Greece who's considered one of the most outstanding figures in the history of medicine. He's often referred to as the father of medicine, in recognition to his contributions to the field as the founder of the school of medicine that it bears his name. The intellectual school revolutionized ancient Greek medicine and established it as a discipline distinct from other fields which have traditionally been associated with theurgy and philosophy, thus establishing medicine as a profession. Hippocrates worked with Galen, and Galen extends Hippocrates' work and creates a humoral theory of mental illness. And treatments, again, at the time remain very crude, but the idea, the tradition, and the thinking linked abnormality with brain chemical imbalances. And this really is a foreshadow of today's modern views. In the 19th century, Louis Pasteur, who was a French biologist and a microbiologist and a chemist, discovers that a general paresis caused by syphilis is linked to psychological and behavioral symptoms. This link is really important because this provided direct support for germ theory of disease and its application in clinical medicine. Pasteur is best known for his inventions in the technique of treating milk and wine to stop bacterial contamination, and this is a process we call pasteurization. This particular link, the understanding that disease caused mental illness, led to penicillin as other successful treatments for bacteria and diseases, and bolstered the view that mental illness is equal to a physical illness. In the United States, John Gray championed biological traditions, and John Gray was a psychiatric expert, and he believed that insanity was always due to physical causes and that the mentally ill could be treated as physically ill. John Gray explained that mental illness can be affected by physical factors relating to an individual, and he studied factors such as diet, temperature, and breathing and ventilation. So what are the consequences of this biological tradition? The consequence really is that there is an understanding that mental illness equals physical illness, and this leads really to Emil Kraepelin, who was a German psychiatrist, and really psychology identifies him as the founder of modern scientific psychiatry, pharmacopsychotherapy, and psychiatric genetics. Kraepelin begins his studies in Leipzig, in the University of Leipzig, with others who studied the idea that one needs to classify, observe, and treat mental illness under William Wundt, who had a lifelong interest in experimental psychology. And this informs Kraepelin to come up with a concept of diagnosis and classification, and this leads us to our modern thinking of psychiatry. The rise of moral therapy, or more humane treatment of institutionalized patients, was an approach to mental disorders based on humane psychosocial care, or moral disciplines, that emerged in the 18th century and came to the fore for much of the 19th century. And these were deriving partly from psychiatry and psychology, and partly from religious and moral concerns. The movement is particularly associated with reforms and development in the asylum systems in both Western Europe and the United States, and they did fall into decline as a distinct method by the 20th century. However, due to overcrowding and misuse of asylums and the predominance of biomedical methods, the movement certainly influenced certain areas of psychiatry and psychiatric practice up to the present days as well. In fact, the approach is praised for freeing sufferers from shackles and barbaric physical treatments, instead of considering things like emotional and social interactions as more important, but also was criticized for blaming or oppressing individuals according to the standards of a particular social class or religion.
There are many proponents of moral therapy across the world at the time when moral therapy is at its height in the US, in Europe, in Canada, in England. However, like all treatments, the moral therapy begins to fall out as there is an emergence of competing alternative psychological models that become predominant on the psychological scene.
Psychoanalytic theory and an exploration of psychoanalytic theory is not complete without looking at Sigmund Freud, who is a famous neurologist of Austrian descent and founder of psychoanalysis, which is a clinical method of treating psychopathology through dialogue between patient and psychoanalyst.
Sigmund Freud is famous for the structure and function of the mind, where he divided the structure of the mind into the id, the ego, the superego. And the id is the pleasure principle, the illogical, emotional, or rational component of the mind. The ego is the reality principle, the logical and rational. And the superego, the moral principles that keeps the id and the ego in balance. Freud's psychoanalytic theory really talks about the human condition being trapped in a defense mechanism where the ego loses the battle with the id and the superego, and where one has displacement and denial, rationalization, and begins to have reaction formation, projections, repressions, and sublimations. Freud is also famous for his psychosexual stages of development, which are very much controversial at the time, where he explores these stages of development in the oral, anal, phallic, latency, and genital stages. I've placed a video in the Blackboard shell that will help you understand more about Sigmund Freud and his contributions and controversies that stem from his work. But later developments in psychoanalytic thought come from Anna Freud and the idea of self-psychology, which emphasize the influence of the ego in defining our behavior. Others begin to look at psychoanalytic thought and emphasize how children in themselves can introject objects, and objects are images, memories, and values of significant others. The neo-Freudians depart from Freudian thought and de-emphasize the sexual core of Freud's theories. Those individuals like Jung and Adler and Horney and Fromm and Erikson really move away from the idea of psychotherapy being stages of development and really unearth the hidden and intro-psychic conflicts that begin to help humans discover their real problems.
So, for example, Jungian analysis would be an individual process to describe a journey that an individual could take consciously rather than subconsciously to discover who and how they want to live rather than who they think they should be in the eyes of others. These techniques are often associated with dream analysis, free association, and examine areas of transfer and countertransference issues. The problem is that these techniques often are long-term and although can be very robust and helpful for individuals, research offers little evidence in terms of the efficacy of these treatments in terms of addressing mental health issues.